Here, so we'll start with the stomach channel. So I'm going to bring you down for just a moment. You can come back up in a second. There's the ASIS. AIIS will be medial. Hard to palpate, to be honest. It's covered with the quadriceps. You know, the rectus femoris attaches there, but then the tensor fasciolata, or excuse me, the sartorius and the tensor fasciolata attach to the ASIS, so they kind of cover this area. But we know it's about there, and I can feel it on you pretty easily. You can sit back up now. So rec fem is going to attach there. Rec fem is going to be more on the midline. So middle group of the quadriceps attaching to the AIIS. And we're going to feel basically a little drop off. Right? So rec fem, drop off. You can kind of straighten your knee, contract, but that's going to contract that whole muscle group. What I could have you do is lift your leg off the table. She's also extending the knee there, so that's going to contract the whole group, but at least I can kind of feel that edge. You can usually just feel it. I can kind of feel like I drop into a little space. It's going to be on the lateral edge of the patella, and I'm going to follow that space up. So that's going to all be a little sore in there, right?
Yeah, it is.
That's going to all be the stomach channel. So it's sore because when I'm palpating, if I'm off the rectus femoris, is I have the fibers of the vastus lateralis that I'm contacting, really right where the vastus lateralis meets the vastus intermedius. It's almost like one muscle. If you took off the rectus femoris, it would almost be like the vastus medialis, vastus lateralis, and vastus intermedius are all one big plane of muscle that have a slight little seam there, but they're almost really like one folded muscle. And we're at that junction, the junction between rec fem, vastus lateralis, vastus intermedius underneath it. So as I'm palpating that seam, so to speak, I'm also over those deeper quadricep muscles. So I'm kind of accessing, sometimes as I press on that, you'll see little fibers twitch of the vastus lateralis. So yeah, a little tension there, for instance. I can feel like the edge of the rectus femoris. And that gives me some indications if I was needling points. I could needle it into the rectus femoris. I can needle deep into those vastus lateralis intermedius. I could angle out into the lateralis, for instance. So it's going to be kind of a seam that unites all of those. As I get higher up, then it'll start to taper, and I'll be right under the ASIS, which will effectively be right under the AIIS, and I'll almost be in the belly of the rectus femoris. That's actually a motor entry point of the rectus femoris. Motor nerve enters there. Another motor nerve enters in about halfway. Right? But it's going to have little slips going to the, the lateral quadriceps, etc. Right? So you're kind of working up that channel by at the edge of the rectus femoris, basically. The medial edge, same idea. It's going to be level with the medial border of the patella, but it's going to be where I drop off of the rectus femoris. Same thing, as I palpate through that, I might see little twitches along the vastus medialis muscle group. Let's see if we can elicit that. I'm going to bend the leg a little bit. Let's see if we can kind of, you don't have a ton of tension sore, sorry. Yeah, but you might see little twitches coming in from here. You don't have a ton of tension there, so I don't expect to see it necessarily, but I can still feel the muscle group there.
Would you tell if there's tension?
Just feels like ropey, more like little bands. The vastus medialis muscle. Sometimes people use the term VMO. You probably know VMO.
Yes,
So
absolutely.
yeah, the fibers, the lower fibers become more oblique, and sometimes people refer to that as the VMO, the vastus medialis oblique, because that has a lot to do with patellar balance and the movement of the leg during gait where it locks out the knee. There's something called the screw home mechanism. When you go into heel strike, the vastus medialis fires slightly before the vastus lateralis.
What do you mean by heel strike?
Like when you hit the heel down and you lock the knee. Yeah, so like when your heel first hits the ground, the vastus medialis fires slightly before the vastus lateralis, and what that does is creates a little internal rotation of the femur, and it locks the joint. So it's called the screw home mechanism. Then there's a muscle on the back, the popliteus, which unlocks the knee joint. So like as you're walking and you go into heel strike and the knee locks to stabilize, and then it unlocks as you follow through. So the VMO is really important for that locking of the knee. So if there's dysfunction there, one of the things people tell you is they have quad pain and their knee buckles. They go up the stairs and they feel like their knee's going to give out or something like that. That kind of points to, the VMO, and you can start thinking about points like spleen 10, for instance, to help kind of wake up, to bring chi. Maybe you palpate and it feels like not taut, but it kind of feels a little atrophied there because they don't use that muscle group so much. So then they start having, maybe buckling with the knee. Maybe they also have like spleen deficiency signs, low energy, digestive, loose stool, that kind of stuff. So sometimes what you feel can kind of reflect the internal signs and symptoms that you get from people. So yeah, so it all kind of comes together that way. But we're going to be following that spleen channel up. The rec fem is going to start going towards the IIS, but at some point we're going to be following more towards the groin, and basically we're following the femoral nerve. And if we get up to the inguinal ligament, we'll be on the femoral, kind of over the femoral nerve, will be lateral to the femoral artery and vein. Right? Good. Try lower leg and then we'll switch up. Or do you want to have somebody else come up?
Yeah, that's fine. Yeah.
Okay.
I'll help you.
So there is a point on the stomach channel. Yeah, you can just move that over. That's good. That's in the little space. Sometimes they call it calf nose or something like that. Looks like a little calf's nose, I guess. But these are called lateral and medial shion. So medial shion is an extra point, not on the channel, but lateral shion is stomach 35. So it's on the lateral edge of that patellar ligament. And then we'll be traveling down into the tibialis anterior. There's the bone, space between the bone and the muscle. So much of the stomach channel is actually over that tib anterior. We have one point stomach 40. Oh, I'm sorry, can I touch this now?
Yeah.
Okay. Yeah, at one point that is kind of a little more lateral, which is between the tib anterior and the toe extensors. As it comes down lower, it starts to go between the, we'll have to get the camera over the ankle here, between two tendons, right? And this is what I was talking about in lecture. If you lift your arch, not your leg, lift your, and then there you go. There's tib anterior. So tib anterior, stomach channel, stomach channel, stomach channel, spleen channel. Goes to the medial aspects, attaches its spleen 4 basically, which is the low connecting point, which kind of talks about some crossover between the stomach and the spleen channel, right? But we're not between tib anterior, and I'm going to push down and have you resist me, and extensor hallucis longus tendon. That's not where stomach 41 is. It's between extensor hallucis longus, and resist here, and extensor digitorum longus. That's one way you can find it, right? Is I can kind of find two tendons, get where I think it's going to be, and then, okay, resist. Yep, I can feel digitorum on my nail side, hallucis on my pad side, right? And I'm right between those. And then it's going to go out into between the second and third metatarsals to the nail edge. All right, spleen channel is going to be on the medial edge of the, yeah, we can see this. This time I want to contract the tib posterior. I'm going to have you keep the toe kind of pointed and lift the arch like this. Oh, yours is not super visible. Let's see if we can see it on this side. All right, keep the toe pointed and kind of like you're turning the arch up. Yep, there you go. Yours is not super visible. Usually we'll see a little shadow. I can feel it. There's the tib posterior. And then this is a point under the malleolus. The floor of that is the tib posterior when I'm palpating over. Usually you can see it, but that's fine that you can't. And it's going to attach to the medial arch of spleen 5, spleen 6, behind the tibia, right over the tib posterior. Go and relax now. And then as I go up the channel, I'm going behind the tibia.